Hi, I'm David Hopcroft, and I retired from working as a Learning Centre manager at a state college in the USA, and I now live in Burnley. I'm interested in the health of population in towns and how this might be related to location, to past history, and to ethnic and social groups within towns. There are many issues that relate to poor health in Burnley, but the issue that particularly concerns me is that of obesity. Why? Because rates for obesity are higher than the national averages in Burnley, and particularly high in children. Not surprisingly, the incidence of type 2 diabetes is also high. Obesity is linked to type 2 diabetes. It's also linked to heart disease, high blood pressure, and a number of other health issues. Now, obesity does not appear like a mystery illness. Obesity is closely related to diet and to lifestyle. Figures for those overweight are high. In Burnley, over 63% of adults are overweight, and by age 10 years, the level of obesity in children is already well over 20%. Given that the wider population also has access to foods containing large amounts of sugars and fats, given that students almost everywhere seem to have a preference for consuming vast quantities of food from fast food outlets, and given that healthy food is available in supermarkets, does Burnley consume more food that is unhealthy? And if so, then why? How much does education matter? Burnley has low levels of education achievement, and the number of residents who are physically active is low, and there are high rates of alcohol abuse. Are low-quality foods and processed foods more readily available in Burnley? Possibly yes. Burnley still has lots of old housing stock, and associated with these are numerous corner shops. Modern housing estates do not tend to have these shops. The area where I live has 5 corner shops within 400 metres, 10 fast food outlets within 800 metres, and 5 pubs within 400 metres. The town has problems with litter. Much of this litter consists of plastic soda containers, crisp packets, and the remains of fast food containers. From garbage tossed away in the street, it would be easy to assume that Burnley fed itself solely on soda crisps and chips. Its history as a mill town was one where ale was consumed in vast quantities. Now, not only beer, but also wines and spirits are freely available at low cost, and Burnley does have a drinking problem. Fresh food is available from a market in the town centre, almost 1.5 kilometres away, and where parking is expensive. In contrast, parking is free at the 3 major supermarkets in the town. But there is no real shortage of fresh produce at these supermarkets. In fact, the choice of fruit and vegetables has been increasing over the last 2 or 3 decades. Does the cost of food influence the choice of foods? Average wages are low in the area. Many work for minimum wage, many are on 0-hour contracts. How does this influence diet? Well, low hourly rates mean longer hours worked, less time for food preparation, so the easy choice for parents is to offer their children fast food. Do they feel comfortable with this? Well, TV advertisements give out a message: don't cook, just eat. A closer look at supermarkets does show that the packaged salad or healthy eating option is more expensive than the burger and chips option at the nearest takeaway. Low wages and high unemployment also contribute to the high number of children who are living in poverty. What measures might be effective in reducing the intake of sugars and fats? Taxation of foods would be difficult to achieve, would hit the poorest hardest, and if fresh fruit and vegetables are already too expensive, might result in an even poorer diet. The results of a Danish initiative to implement a fat tax proved to be counterproductive. Cheaper, less healthy food was chosen. Warning signs might well prove to be effective, as they did in campaigns to reduce tobacco consumption. But such warnings would need to be much larger and clearer than the small text used for warnings on alcoholic drink containers. However, the proactive approach is probably the most effective. Obesity, for many, though not all, is a choice. We choose what we buy to eat and to drink. We choose how much exercise we undertake. Poor choices lead to ill health from obesity, and we can change this by changing lifestyles. Burnley is attempting to promote healthier lifestyles, so the future may see a slimmer Burnley. When new housing is planned, there is a need to increase the areas set aside for children to play. The local soccer club offered a deal to supporters who wanted to keep fit, exercise in return for reduced price tickets. These initiatives would be even more effective if there were national policies to increase the availability of playing fields at schools and to restore physical exercise and games as a vital part of the curriculum. Reducing poor behaviour and promoting healthy lifestyles may not be enough. Even with good education and promotion of healthy eating, the probability is that Burnley will still suffer health issues higher than the national average, unless the social issues such as wages, employment and replacement of old housing stock are also going to be tackled. The last issue is the one that interests me most. Poor health does seem to be associated with a reluctance to promote regional development. Hopefully that will change in the future. This ends my short video. Thank you for watching and for listening.